I brought this book because it somehow reflects my interest in bioethics. It's a book entitled The Doctor's Dilemma by George Bernard Shaw. And it's a book full of ethical dilemmas regarding the activities of physicians and doctors. I was a good student at medical school. I did pass my examinations, as most of my colleagues. I had 1 semester of bioethics, and after a while, you have problems that you deal with in your clinical work, and you're not prepared for it. I'm a medical oncologist, so I work with cancer patients at the emergency room, or when I am on call, I deal with end-of-life issues, and I missed some formal education that would give me the possibility to have better arguments and better tools to reconcile the strong issues that I face. The reasons that made me choose the program of the Master of Bioethics at KU Leuven was that the program included, not only themes that you have to find in all bioethics program, like, end-of-life care, training, and so, but it had a very strong component on the ethical and social implications of human genetics. And I work with hereditary breast and ovarian cancer, so that was very important for me. Either at the end of life of my patients or when discussing the impact that a genetic test can have on a patient, on her family. And so I really miss that. And I think it's not only me that misses that. I think that physicians in the clinic nowadays are too much equipped with clinical knowledge and technical knowledge. And the technical knowledge is becoming very complex. And you cannot just apply that technical knowledge. It's not only because you can do it that it's proper to do it or that it's good to do it. This seems very simple or very simplistic when, just said like that, but it really happens. And that's very important about the book because it's kind of a satire that some doctors behaved like God. They would choose who to treat and how to treat. You cannot do that. You have to treat your patients, all of them, the best you can. You cannot just apply the technique, it's not universal. You have to learn, you have to be equipped with tools to reconcile that. And definitely, I now know better, and I try to transmit that to my younger colleagues.